name is Dr. Hunter Dyer. I'm a neurosurgeon at CNSA, and I've been here in this practice for 31 years. We see many patients that have cervical disc herniations. When we see a patient with a cervical disc herniation, if they have spinal cord compression or if they have nerve root compression on both sides affecting the spinal cord and the nerve root, they need a procedure through the front of the neck. Yeah, many of the cervical surgeries that we do involve an approach through the front of the neck. When somebody has a ruptured disc that is compressing the spinal cord, they're often surprised that we go through the front of the neck, but the vertebrae and the disc are actually in front of the spinal cord that runs down through the middle of the spinal canal. So if it weren't uncomfortable, you could put your finger right on the front of the spine, which is right behind the trachea and the esophagus. So we make an anterior incision, we can go in and take out a disc, we can alleviate that compression. And in a lot of people, we do what's called a cervical fusion, where we remove the disc, put a spacer with bone graft material between the two vertebrae and a plate on the front. And then a more modern technology that we are able to do in many people now is an artificial disc. So we do the same operation, decompress the spinal canal, remove the disc, and then we implant an artificial disc in the space so that the vertebrae do not have to be fused together. And then there's a small subset of patients that have a pinched nerve in the neck related to a ruptured disc. If the disc fragment is out to one side, for instance, giving somebody severe right arm pain, we can go in posteriorly through the back of the neck, and we can take a drill and open up the channel to expose that nerve, and we can sweep out that disc fragment using either microscopic or endoscopic visualization. So those are some of the happiest patients we have, because they don't have implants, they don't have a long recovery, and they have relief of really profound, severe arm pain. The anterior surgery that we do through the front of the neck, actually people typically recover fairly quickly, but sometimes they have pain between their shoulder blades for a couple days or a week when they have an anterior fusion surgery. Sometimes they have a little difficulty swallowing, and I tell my patients to be careful with swallowing for several weeks. They can have hoarseness, although typically that resolves pretty quickly. So it takes anywhere from 3 to 5 weeks to typically recover from neck surgery through the front of the neck. The procedure I described going posteriorly for a disc herniation, the recovery from that is quicker. Typically patients have muscle spasm, they do require some pain medicine, but not for a long period of time, and they really don't have big restrictions, so they're back to most of their activity within several weeks. And so that's the procedure of choice, but admittedly it's not a huge population that can have the posterior procedure, but for those that can, it's certainly ideal. We do larger procedures in the back of the neck that include a laminectomy and typically placement of instrumentation in the neck. That's when people have multi-level compression and require a large decompression of the canal. If somebody has one disc herniation that's compressing the spinal cord from the front of the neck, then we typically will go from the front to remove that disc and either do a cervical fusion of that level or an artificial disc placement. Certainly our goal is always to avoid surgery on everybody if we can, but there are people that walk in with months and months of pain or significant neurologic problems that require surgery.